The following is a list of doctors who were involved in the Medex clinical trials at the Royal Hospital for Women and at the Royal North Shore Hospital. All of the doctors deny involvement in the Medex clinical trials and deny signing documents bearing their signatures and handwriting. There are 5 requisition forms signed by Dr. Neville Hacker and Dr. Donald Marsden at the Royal Hospital for Women, clearly showing that payments were approved based on work completed. A letter dated 6 May 2009 signed by Dr. Gilbert Burton from the Royal North Shore Hospital clearly outlined the work completed for a pilot clinical trial. A letter dated 12 June 2009 signed by Dr. Kenneth Vogue from the Royal North Shore Hospital clearly outlined the work completed for a clinical trial involving approximately 200 patients. Several other documents related to the Medex clinical trials were signed by doctors at the 2 hospitals. These documents include ethics applications, clinical trial reports, payment invoices, contractual agreements and patient reports. During my local court proceedings, all the doctors involved gave evidence in regards to their signatures on the documents in question. The following is what each one had to say.
Show you this document.
Yep.
You could just read through that document whilst having Exhibit 20 open at the same time.
I think just from a cursory glance they're virtually identical.
When's the first time that you saw that particular document that I've just shown you?
When Michael Caine showed it to me.
It bears a signature on the second page, does it not?
That's right.
Is that your signature?
Looks like my signature.
Is it in fact your signature?
I did not sign this letter.
Do you have any?
Moving on to Exhibit 32, is that what you're doing?
Yes, I want to put to you, Doctor, that signature and that date on that document, Exhibit 32, is a document that you signed, and that is your signature, and that is the date that you wrote on it. What do you say about that?
It looks similar to my signature, but I recall just signing one document.
Thank you, Doctor.
Operation Charity, Exhibit 26.
Okay. Now, my friend asked you to look at that letter previously. Do you recall that?
Yes.
And this letter is dated the 8th of May 2009?
6th of May.
Sorry, 6th of May. My glasses are not as good as they should be. The 6th of May, thank you, that's better, 2009. And would you have a look at the signature and give it some thought? Doctor, is that your signature?
Looks like my signature, but I didn't sign this document.
All right. I may approach the witness now.
Yes.
Asking all these questions. Doctor, could you have a look at that letter and read it first to yourself? And is that your signature at the bottom of the letter?
It looks like my signature.
Do you recall ever signing it?
No.
Well, you say it looks like your signature. Is there anything in that signature that stands out which says it would not be your signature?
No.
But you just don't remember signing it?
No.
Okay, thank you. A blank form.
No, it wouldn't be a blank vendor form.
So,
I didn't realise, if I signed those forms, I didn't know the purpose of those forms.
but you've told us you didn't sign them, Doctor.
I don't believe I signed them. And my secretary looks at the signature and says, that's not your signature.
Is that what your secretary said, did you?
Yes.
And you accepted what your secretary said?
No, we discussed it together. And
Just finish off the question. And so you follow what your secretary tells you about your signature.
No, it's not that. No, I haven't said in the beginning. I said I don't believe they're my signature.
Thank you. Now, Doctor, you received, did you not, a subpoena from the defence, that is from Mr. Norbert Kelvin, K-E-L-V-I-N?
That's correct.
Yes, and you didn't honour that subpoena, did you, Doctor?
Was that a subpoena to...
Produce samples of your handwriting from various...
No, I didn't honour that.
There's a reason why you didn't honour it?
I think, I can't remember the details, I'm sorry, but I think I asked advice about it and I was told not to do it. I can't remember the details, but I don't have that subpoena. I haven't seen that. I mean, I don't understand where that subpoena is. I did.
You have seen the subpoena, Doctor. You even wrote a letter to Mr. Kelvin here telling him you'd seen it.
I wrote a letter. I've got that letter here.
Yes, I know you have.
But I don't recall the details of that.
But you did write a letter to Mr. Kelvin, Norbert Kelvin,
Yep.
saying that you had received the subpoena, hadn't you?
Yeah, I wrote a letter.
Yeah.
But I didn't really...
Now you have a letter, but did you tell Mr. Kelvin that you had received that subpoena?
I can't recall what that letter says.
Now, Doctor, just take the exhibits 59, and I want you to look at invoice number 102 151 008. I don't think mine are in order. I'll just try this way, Doctor. I'll do it this way. 105 201 008. Thank you. Now, would you look at the bottom of that document, you'll see B, Authorisation Officer, Profit/Trust Manager. Do you see that?
I see that.
And you see the name type Pavlakis and then Nick?
Yes, I see that.
Okay. Now, have a look at the signature. Do you say that is or is not your signature?
There's a similarity to my signature.
Right, well, I will come back to that. What's the similarity?
There,
On the P?
on the curves.
On the curve. Right. And what about the 16208?
That looks similar to how I could write it.
Right. Now, if you've looked at that invoice, Doctor, before that non-order voucher, do you say that you signed it on the 16th? Sorry, withdraw that. Do you say that you signed it?
I cannot say I signed this knowingly because I would not sign off such a document for materials or activities that my department was not conducting.
Then you see that the authorising officer's name, can you read that?
Yes, I can see last one.
All right, and is that your handwriting at the authorising officer's name?
Well, it looks like my handwriting, but I don't believe it is because I was not.
Does that look like an original with a pen mark?
A signature that's been written in pen rather than copied onto the document. Is that what you mean?
That's what I mean, Your Honour. Yes, thank you.
Yes, it is possible that these are my initials, but I did not sign this document.
Thank you.
It is apparent from the evidence in my local court proceedings that the doctors have given similar responses when questioned about signatures on documents related to the Medex clinical trials. The remarkable similarities in their evidence suggests that the doctors may have been coached to give similar evidence. All the doctors involved in the Medex clinical trials at the Royal Hospital for Women and at the Royal North Shore Hospital gave false evidence under oath in relation to their involvement in the clinical trials and in relation to signing various documents related to these clinical trials. Strong forensic evidence confirming the authenticity of the doctor's signatures and or handwritings on documents in question has been dismissed by the ICAC and the Department of Public Prosecutions. This has provided protection for the doctors and their reputations. The doctors involved in the Medex clinical trials have not been held accountable for their false evidence, nor have they been held accountable for allowing human clinical research to take place without ethics approval for the Medex clinical trials. Many of the doctors continue to practice medicine and supervise research students for clinical trials and/or medical research. All of the doctors involved in the Medex clinical trials have had years of experience in their positions. It is highly unjust that the doctors have been afforded protection in order that my sister and I be falsely prosecuted.